Good morning. Uh-oh, I'm worried the caffeine did not hit. Let's try that again. Good morning. Okay, there we go. So I want to help answer all of the questions I've heard this week around how much is this going to cost? And how do we develop a financing plan and start to understand the resources that we have available? I will caveat that in the time that we have, I'm not going to be able to train you on the tool. So if you see a big Excel file and you start to feel overwhelmed, please don't worry. There are lots of resources available on R4D's website. And my hope is to orient you to the tool so that you can access it both on the R4D website as well as review the instructions within the tool. We've tried to create it to be very simple and adaptable and user-friendly. I want to apologize to some of my colleagues. Right now, this tool is only available in English, but if there's interest, we can absolutely explore translation and making it available for additional contexts and countries. Because I'm new to this forum, I wanted to just briefly introduce myself and Results for Development. So my name is Amy Roberts. I work at Results for Development. We work at the intersection of health, education, and nutrition. I'm joined here by my colleague, Johannes Adisu. Johannes, feel free to wave and say hello. We are both on the market shaping practice, so we work actually across products and programs to take best practices in market shaping and improve access to life-saving and life-changing commodities. We work in very close collaboration with our nutrition practice, so trying to bring kind of the best in the expertise of nutrition and market shaping to improve access to commodities like MMS. Just to provide a little bit of context around the work that R4D is doing in MMS so that you can understand what was the perspective that kind of came into generating this tool, how is it being used, why did R4D sort of take the lead in helping to put this together? On MMS, we are working at both the country level as well as supporting some work at the global level, which you'll hear about more today when we share the tool. We have teams in Ethiopia and Nigeria supporting the governments to introduce and scale up MMS. As you've heard in other presentations, R4D is partnering with UNICEF and the government of Ethiopia to help develop the MMS roadmap and cost it. We are doing similar work to support in Nigeria, both at the federal level and in 2 focal states. All right, so what does this costing tool do? And what is sort of the appropriate use case for this tool? Because we've also heard about other tools during this meeting. So the ideal use case for this tool is once a country has decided that they want to adopt and scale MMS. There are other tools, like the great tools that Nutrition International has developed that will help with the initial decision-making before we get to the point of making that affirmative decision to introduce and scale. So this tool does not help understand cost effectiveness or cost of inaction, and I has some fantastic tools for that. This is ideally used, once a roadmap has been developed and, a country is looking to then cost the activities and the strategies within the roadmap. I think it's important to note that when we talk about roadmap development, we talk about discrete activities like, okay, we're going to develop the roadmap, and then we're going to cost it, and then we're going to make the financing plan. But we know that in reality, these are really iterative processes that feed into each other. And so the goal of having a costing tool available as countries start to build roadmaps is so that you have the ability to look at multiple scenarios. Maybe there's a few different ideas for how we want to do training, and by costing them and looking at some different scenarios, it will help us determine what goes into both the roadmap as well as our financing plan. So ideally, the costing tool is part of an iterative process of roadmap development and creating a financing plan. The costing tool itself will help you understand over a 5-year time horizon or a shorter time horizon, if you prefer, the total cost of MMS introduction and scale up. And you can look at the cost in a variety of ways. So you can look at cost by year, cost category, different type of cost. The tool also provides some helpful summaries along the lines of the cost per pregnant woman reached by year. Just a little bit of background on this tool, how it was developed, where it is now. R4D, in consultation with a small consulting firm that has global costing expertise, developed this tool in June of 2024 for a costing workshop in Addis Ababa that followed the MMS Programmatic Forum. With the help of the costing consultant, we got input from a number of partners listed here prior to the workshop. And then we developed a tool and used the workshop to gather user feedback and generate a new version of the tool. So just want to thank the partners listed here, as well as representatives we had from the Ethiopian and Nigerian government, and give you a sense that this tool has already had some level of iteration, and our hope is that it's useful for any country. It's not just an R4D tool, but it's something that can be deployed by any country, by any partner, as a support to help understand, what is the cost going to be to do this work. Okay, I'm going to quickly orient you to the overall structure of the tool, just so you understand how it works, and then I will give some examples of different parts of the tool. So we've tried to create the tool to be a simple, structured approach where we're taking activity-based costs from the roadmap or implementation plan, and we're looking at what those are per year across standardized cost categories in the tool. And so you'll see on the right-hand part of the slide, we have several different cost categories. And within the tool, some of the cost categories have very specific calculators, like training and service delivery, whereas others are a bit more open-ended, like supply chain. And so within the tool, you'll be kind of walked through how to calculate costs across different categories. There are some important data inputs that go into the tool. You'll notice that there are auto-populated data inputs that are sourced, but we've also structured the tool so that a country can input their own data. So if we've used statistics for population for a country and the data source should actually be that country's Bureau of Statistics, you can just go in and manually change the target population. You're also able to input target coverage of MMS, and it will help you estimate the number of pregnant women who can potentially be reached with MMS. I think it's important to note here that the way the costing tool is structured can give us a sense of some of the outputs our roadmap needs to have. So we need to know when we go to cost the tool, what is the target coverage for each year once we start to introduce and scale up. As I mentioned, there are several cost categories within the tool. What might make the tool feel a little bit overwhelming is that these are each separate tabs. We've separated them out to try and support really detailed planning and costing of these key activity categories. And I'll show you a few examples when I get to the demo. Another way we're able to capture costs within the tool is by categorizing introduction and transition costs and ongoing costs. So the tool will be able to give you a sense of what are those one-time startup costs that we just have to make sort of one catalytic investment versus what are going to be the ongoing costs of the product and some of the core activities associated with scaling up this product and then maintaining the system. I've already kind of gone into this, but there are several outputs and sort of visual analyses that we aim to provide that will help you understand costs across a variety of different indicators. Okay, the tool is coming shortly. So I want to just give some information on how you can access the tool, because I think it's far more important that you're able to download it and access the resources on the R4D website. So you can find the costing tool on the R4D website. It is linked in the presentation. I think you can also Google MMS costing tool R4D, and it will take you to a specific web page. I can actually show that right now. So we have a page on our website that features the tool. You can download it right at the top of the page. And then we've also provided some explanation. And unfortunately, it looks like my computer is offline, but there is a demo that's 30 minutes long that walks through the tool in more detail than I'll be able to go into today. So that is a good thing to watch. We've also hosted a webinar on the tool and can share the recording of that. And there's a little bonus where, given that, especially in some devolved or federalized contexts, we recognize that sort of individual counties or states may need to do this costing exercise on their own. We've developed a subnational geography aggregation tool.